Good evening, Barbadians. Overnight, the Ministry of Health and Wellness, through its Public Health Laboratory, conducted 22 COVID tests, of which one was a positive test, bringing the numbers of confirmed cases in Barbados to 34. The number of cases that we have recorded so far have resulted from over 250 tests that we have been able to conduct. I want to say at the beginning that these confirmed cases, for the most part, have been Barbadians returning from overseas or Barbadians coming into contact with persons coming from overseas. We have 21 Barbadians who have contracted the COVID virus, with 5 other persons who are non-nationals, but 5 persons who reside in Barbados. Of the visitors who have contracted COVID-19, there are 5 from the United Kingdom and 3 from the United States of America. Several of our persons would have contracted the virus as a result of being in close contact with someone who had contracted the virus. And I'm saying that to say that the spread of the virus in Barbados is a result of Barbadians, some who did not heed the call from the Ministry of Health and Wellness to avoid non-essential travel, but who have traveled abroad, and so they contracted the virus when they made their travels. And for the remainder of persons, we have been able to contain the spread, especially through the contact tracing that we have been aggressively pursuing. And I'm saying that because it is up to us, up to you, and up to me. It is not a Ministry of Health problem. It's not a problem for the Queen Elizabeth Hospital and the other facilities. This is a problem that each and every one of us must play our part so that we can contain the spread of this virus. I have every confidence in the capacity that we have created at the national level and in the ability of those members of staff that we have within the Ministry of Health and Wellness, and by extension, the wider public health and medical professional community here in Barbados. We can do this. We can contain the spread of this virus, and we intend to do so. But it has to be a national effort. And every citizen, every resident here in Barbados must heed the call. We must obey the instructions and directives of the Ministry of Health and Wellness and the government, and we must do what is required in terms of keeping our surroundings sanitized, looking after ourselves, professionally distancing ourselves, as well as for us to be able not to gather in numbers that will create problems for each and every one of us. If one person does not adhere to the advice of the Ministry of Health and Wellness, then that person is going to put all of us at risk. Let us do this together. And remember, these things are in our hands for us to be able to contain the spread of COVID-19.
Good evening, fellow Barbadians, residents, and visitors who happen to be in Barbados. I'm happy to take this opportunity to speak to you about what has taken place over the past couple of days since the government of Barbados has implemented a number of restrictions under the public health emergency that has been declared. The intent of this declaration has been, and always has been, the protection of the people of Barbados from the spread of COVID-19. The restrictions that have been issued in relation to observation of physical distancing, observation of the requirement to minimize to essential travel only, those persons who are leaving their homes, the requirements of observation of the period of curfew, which has been posted and made available to the people of Barbados. These are measures that have been applied for, as I said, the sole purpose of reducing the spread of COVID-19. I have, over the past couple of days, and particularly today, made it my business to check to see whether or not the behavior of Barbadians has been consistent with what we expected and hoped. We've seen a number of behaviors from Barbadians that are inconsistent with our expectations and with the spirit of what we expected and anticipated Barbadians would have done in response to the restrictions that were issued. We've seen people in queues at supermarkets and banks and other places of business not observing the physical distancing that we have basically expected and that where we have issued the requirements and the restrictions. We've seen congregations of people at the beaches, at other places of entertainment, again inconsistent with the restrictions that have been put in place. The numbers the amount of traffic that we've seen on the roads, if my grandmother were describing it, she would describe it like federation. All of these things basically have brought us to a point where we are very concerned that Barbadians have not been responding to the requests and the restrictions, and we ultimately will face a situation where those restrictions will be of no effect. I want to urge Barbadians, basically. I want to urge fellow citizens, residents, and visitors. We have an opportunity by our own behavior to bring this virus to a halt. However, it will be an act of ultimate irresponsibility if the government of Barbados allows the few persons who are reckless, the few persons who are not prepared to abide by those restrictions, to put the health of all of us at risk. More than 60 years ago, my mother told me, "Hard days you won't hear, own way you will feel." For those persons not familiar with the Barbadian vernacular, that statement essentially says that if you fail to abide by the instructions and guidance, then the consequences are yours and you will have to face them. We are at that stage now, fellow Barbadians, that if we do not abide by the instructions that have been given, if we do not respect the curfew hours, if we do not respect the social distancing that we are expected to maintain when we go about our business, if we do not adhere to the basic advice of restricting your movement only to those occasions where it is ultimately necessary or absolutely necessary for you to leave your homes, then we will face a situation where the advice from the Chief Medical Officer and myself will be that those restrictions should be extended. I am confident in the fact that we have allowed Barbadians to exercise their judgment, to follow reason, and to basically behave in a manner that will be consistent with getting this virus to where we want it to be, and that is zero. For those persons who have that unhealthy preoccupation with numbers, I say to you that there's one number that is important, and that number was given 2 weeks ago. We registered our first case, and that is the only number that matters. The virus is here, and the only way that we can beat it is to behave in a manner consistent with the advice that is being given by the health authorities. I have seen a number of hard-days Barbadians, and I make no apology to persons who might find that term offensive, because you would only find that term offensive if your behavior is inconsistent with the advice that you've been given. We ultimately, the government of Barbados, will not allow the behavior of a few reckless persons to put this entire country in jeopardy.